menopause. It is a normal part of the aging process for women. Sometimes women worry about going through the change because of what comes with changing hormones. So joining me right now is Dr. Jennifer Johnson from Trinity Health. Thanks so much for being with us. So we're talking a lot about nervousness, stress about it, but let's start with the basics and talk about what menopause is.
Menopause is a normal physiologic ovarian aging that is then preceded by lack of menstruation. And we all go through it.
And talk about the ages and the symptoms and things like that.
Sure. The average age is 51 and a half years. We know statistically that by the age of 55, 85% of us will have gone through menopause. We typically start in our mid-40s and we go through into our early to mid-50s. And the transition on average takes about 4 years.
Mm-hmm. All right, so talking about the beginning stages and the symptoms and what people might start to notice as we go in through the end of it.
Sure. So typically in the beginning we will have some vasomotor symptoms, which are the hot flashes and night sweats. Somewhere between 70 to 85% of women will experience those symptoms. We have mood swings, we have fatigue, we have sleep disturbances, we have vaginal dryness, we have decreased sexual desire, we have weight changes, we have hair changes, we have memory issues, so it ranges the full gamut.
All right, so that's a lot. So we can see why women start to stress out about it, but you're here to tell us why, you don't always have to do that because there's options, right?
Yes. When I see my patients, I usually break the options into two general categories. Mm-hmm. We have medications and then we have non-medications. Medications I do break down into two categories. There are FDA-approved hormonal treatments, ranging from a patch to oral, which is systemic, and those are estradiol and progesterones. We have local forms of treatment, which range from tablets to a ring to creams. And then we have the non-medications. Then we have the non-hormonal medications,
right.
Which range from a newer FDA-approved neuromodulator to...
How do those work?
Those work on some receptors in our brain, and they have been shown to decrease vasomotor symptoms by about 75%. Mm-hmm. So that is the newest one on the market that has been recently studied and released by the FDA. There are classes of anti-anxiety medications that are used to treat vasomotor symptoms. Mm-hmm. There's also classes of anti-seizure medications that are used off-label. There's some antihypertensives that are used. So there are many different classes of medications. Mm-hmm. And then the non-medication kind of general category are cognitive behavioral therapies. And they basically focus on what we're thinking about and what are the issues that are bothering us. So for some women, they know triggers that will increase their hot flashes, such as caffeine or alcohol. And so we can modify when they ingest those things so that at night perhaps they're not waking up as often, having the hot flashes and night sweats that disturbs their sleep, which then makes them tired the next day.
So what advice do you have for women who are watching?
What advice do I have? Generally speaking is please have this conversation with your healthcare provider. Mm-hmm. There's many things that we can reassure you that are normal. A lot of women need that reassurance because we're wondering what's going on with us. Are we going crazy?
Right. So it's really important to make sure you're getting your regular checkups and
yes.
seeing your doctors when you're supposed to be at least annually.
Yes.
All right, important stuff. A lot of information, and we appreciate your time.
Thank you very much.
Thanks so much, Doctor. Nice to meet you. Thanks
You
for
too.
being here with us.
Thank you.
All right.